मेरा तबीयत ठीक नहीं है।
तो फिर चेकअप के लिए अस्पताल जाएं।
अस्पताल मेरे घर से बहुत दूर है और मेरे पास पैसे भी कम है।
इसके लिए कई विकल्प हैं, जैसे 1 नेचुरोपैथी, 2 आयुर्वेदिक और 3 होम्योपैथी। चिंता मत करो, अस्पताल ही केवल एक समाधान नहीं है, बल्कि आपके पास कुछ रियल हेल्थ नॉलेज होना चाहिए। इस ज्ञान को प्राप्त करने के लिए हमारा चैनल रियल हेल्थ नॉलेज पर जाएं। प्लीज हमारे चैनल को सब्सक्राइब करें, बेल आइकॉन को दबाने मत भूलिए ताकि हमारा लेटेस्ट वीडियो की नोटिफिकेशन आपको मिले। वीडियो को लाइक करें, ज्यादा से ज्यादा शेयर करें अपनी दोस्तों के साथ। थैंक यू।
Nature does what it does. Now somebody wanted to know what happens when you take a chemical medicine. Chemical medicine is a new idea, Western idea. Wall Street greed, eh? You don't know that. I'll tell you what. They said, what will happen? So a professor of medicine, to be very precise, professor of genetics in Washington, Douglas C. Wallace, D.C. Wallace, did a wonderful study. He invented a chip called the MIT chip, mitochondrial chip, his own invention. So he tags it on to the drug and gives the drug to the patient and traces it where it goes. The chemical drug goes inside the system to the stomach, and the human immune system, human wisdom says, what is this? This chemical I have not seen. My forefathers have not seen. It has never been in our race. So it must be some poison which has come in. Throw it to the liver. That's what happens to any poison. You take a poison, it's first sent to the liver. So every chemical drug that you swallow goes to the liver. Mark my words. Every drug goes to the liver. When it goes to the liver tries to best it possible destroy it. If something remains, it comes out of the liver. That's called the first pass effect. Some of the medical doctors here sitting must have heard pharmacology class. First pass effect. First pass effect means what remains of comes out of the liver. It's a very small amount. That might do harm, but the liver is definitely damaged. That's why today we have a new disease called non-alcoholic cirrhosis of the liver. It's an epidemic actually. When I was a student, we only knew one thing. Cirrhosis means alcoholic cirrhosis. Now new disease is almost cirrhosis, alcoholic cirrhosis has disappeared because people are now afraid drinking too much of alcohol. There are a few. But every one of us possibly is a candidate for non-alcoholic cirrhosis. If it's not greed, what else is? Tell me. So Douglas so beautifully showed that none of these drugs are accepted by the human system. Whereas he tried Chinese and Tibetan herbs. He didn't try Ayurveda because Ayurveda is very unpopular in the West. Or at least it's becoming popular now. But in America, Ayurveda has not been very popular. But he took Chinese herbs and Tibetan herbs. The minute the herb goes into the stomach says, aha, this is new. I know it. It's part of the food that my ancestors were taking. And it's not thrown into the liver. And directly goes, and if it can do some good, it does. This is what happens.
आपको हमारी वीडियो कैसे लगा कमेंट करके बताएं। वीडियो को लाइक करें, शेयर करें और आप हमारे चैनल में नए हैं तो प्लीज़ चैनल को सब्सक्राइब करें और बेल आइकॉन को दबाएं। थैंक यू, हैव अ ग्रेट डे।